News at 10.
Is it the answer to your healthcare prayers or something you'd be smart to avoid? That's a question about controversial new health clinics popping up in surprising new locations in our area. And it's the subject of tonight's Fact Finders Report. Here's Peter Thorne. Peter?
Katie, 47 million Americans with no health insurance. That's the problem. But is what you're about to see part of the solution? Critics say don't bet your life on it. Welcome to the brave new world of retail health clinics. It's Friday night, your doctor's office is closed, and you're in an ambulance on your way to the ER because your child is sick and you're scared. For the longest time, your only choice was an expensive trip to the hospital. But now all that's changed. Welcome to the world of retail health clinics, medical clinics staffed not by doctors, but by nurse practitioners.
Just gonna check your blood pressure.
A nurse practitioner is board certified in family medicine, and we can actually treat, diagnose, prescribe as medically necessary.
Now doing all that inside retail stores like this one at CVS, open after hours and on weekends, just steps away from the greeting cards and party supplies, sunglasses and soda.
All right, have a seat, and as soon as we're done with that patient, we'll get you in, okay?
This one's called Minute Clinic, offering convenient, low cost, no appointment needed, basic medical care to everyday shoppers.
I strongly believe that Minute Clinic is really doing a good thing for the community.
Suddenly, hundreds of in-store health clinics, not just at CVS, but Walmart, Walgreens, and Target, even some supermarkets, and with thousands more planned, they're coming to a store near you.
Our target is that mom who, has 3 kids in tow, and they all have an earache or a sore throat, and we can get them in and out and get mom, on her way, home for dinner with the kids.
All in about 15 minutes. Health insurers love them because they lower cost. And for the 47 million Americans with no health insurance, the price is right. Average bill, about $60. But it's not all good. Some doctors warn you could be gambling with your health.
We're concerned about the Minute Clinics. It relies on one important thing. It assumes that the person who has a complaint knows what's wrong with them, that the cough is a cold and not pneumonia, cancer, a tumor, or tuberculosis. Going to a Minute Clinic for a minute diagnosis can let things slip through the cracks.
Worried about everything from quality of care to cleanliness, he thinks patients need to really think twice before ditching their doctor and stepping into a Minute Clinic.
We're also concerned that these do not follow the same rules and regulations and requirements that a physician's office has to follow. There are no physicians, there are no imaging studies, and there are no laboratory facilities for diagnosis at one of these centers. Better word would be a nursing kiosk. These are not clinics. Minute Clinic, I don't think so.
But such caution's not a concern for this patient.
All the congestions, my ear's been bothering, my throat is kind of scratchy.
Natalie's sick and didn't want to wait for a doctor's appointment.
I was trying to find a regular doctor here, but then this came up and it's, short. They said you don't have to wait, you don't have to call, so this was my best option.
She gets a full exam, a prescription if needed, and she's just fine that her care did not come from a doctor.
No, just somebody at least that can diagnose something and give me medication so I can feel better, you know what I mean?
Still, the American Medical Association wants the clinics investigated for possible conflict of interest. Writing prescriptions just steps away from the pharmacy. Some critics see a transparent effort by stores to boost sales.
Think about it. How many times have you been in a doctor's office and exited through a pharmacy? You can't. That would be considered medical misconduct or professional misconduct. We have a lot of concerns.
Natalie's big concern before her visit to a Minute Clinic, probably similar to many other customers. Pressed for time with money tight. How soon can I get back to work? And let's face it, for a lot of folks, that is the bottom line. How soon can I get back to work? Now, despite the controversy, with a shortage of family doctors and a health insurance crisis with no end in sight, you can expect to see more of these clinics offering basic medical care at a price that is, frankly, tough to beat. Now, if there's a story you want us to look into in depth, please let us know at cw11.com/factfinders. And I think it's pretty clear what's going on here. The politicians seem to have dropped the ball in the health care crisis. Private industry is stepping in to fill the gap.
I was going to say, if the medical establishment has such a problem with these clinics, then they need to take steps to try to get Americans insured.